Now, I'd like to introduce you to two of Craig Hospital's clinical care managers to get their suggestions about self-advocacy.
I'm Ashley. I'm a social worker here at Craig Hospital. I work specifically on the outpatient program with brain injured individuals and a few spinal cord injuries as well. I meet with clients every week to discuss resource facilitation, self-advocacy, community resources. We do a bit of counseling. Self-advocacy is really learning how to find yourself again, learning how to effectively communicate, problem solve, being able to negotiate, and able to get something across to somebody you're speaking with. So being able to find yourself again and being able to have control. I think the hardest thing about having sometimes a brain injury in particular is you lose some of your cognitive abilities, and so your ability to problem solve is a lot more challenging. And so one of the greatest kind of assets or skills that you can build is actually to learn how to accept help. And I think that's really, really hard to do. And asking either a family member or, a good friend or even a social worker that you have confidence in to help you through a situation so that you feel like you're more in control is really helpful. So finding those partnerships, being not afraid to ask questions of the who, the why, the how, and the what. And the how is really important because you have to learn how to put something into action before you can actually get information and understand that information coming back. I think the hardest thing that I've seen in my practice so far is that there's a lot of barriers because people have never experienced the medical field. And so you have issues with health insurance and what benefits do I have? What doctors do I go to? What questions do I even ask? Because we're not going to doctors, it's like, oh, I have a physical ailment. How do you heal that? It's really not about healing. It's about, what steps do I need to take to enhance the skills that I need to kind of keep moving forward in my recovery. So going back to what I was saying before a little bit is, being able to have questions written down, whether it be on a tablet, in your iPhone or Samsung phone, or even written down in your calendar or memory book, whatever strategy you have to take with you to a medical appointment is really essential to being able to know that you are heard, that you've gotten all your questions answered, and that your issues and needs were addressed. So I think that's a really big part of advocating for yourself. It's also good to bring a friend along or a family member to be right there with you in case you don't take in any and all of the information. For all of us, it's hard to go to a doctor's appointment when there's a lot of medical jargon being thrown around and you're just not 100% sure what's actually being said. I think you can also ask the physician, or if you're at an appointment that's really important, to see if you can record it. So that helps you when you leave the appointment. If you have any other questions afterwards, you can replay it and see what you've missed. See if there's another question you had afterwards that you need to follow up on. So it's really about gaining those type of skills and putting into place strategies for yourself to be able to compensate for your deficits. I think whenever you are going to go to, say, a doctor's office, you should always carry with you, your medication. Know your medications by heart, or else carry them on a notepad, making sure you know what you're taking, what the dosage is, why you take it. It's It's really important that you know why you're taking the medication that you're taking. If you have any allergic reactions. I always recommend, if you have the ability, make a notebook of all of your medical records. So then you can, if a doctor's asking you a question you don't know, you can say, these are my medical records, and I'm providing you with the information. So that would be kind of my recommendation with what to ask and what to bring with you when going to a medical appointment. I think the best resource within the communities at large is the Brain Injury Alliance. They're very well tied into the community. They have the most local and up-to-date information about community resources. They're our largest partner here at Craig in trying to get folks reconnected to their community at large. That's a great resource. I think another great resource is any of the county offices. They have a lot of Department of Vocational Rehab is another great resource, and that's part of a county service. I think that to be a good self-advocate, you have to practice first and foremost, whether that be practicing the questions that you've written down with a friend and saying, hey, how does this come off? They may give you good feedback as to, are you making good eye contact? Am I speaking too quickly? Do you understand me? Is my question clear? So I think practicing is key to success. And I think every time you go out into the community and you try it, that's one step in the right direction. And just keep trying it. And sometimes you might get frustrated. And it's okay to acknowledge to that person, I'm getting a little bit frustrated. I need some time. And then just take a moment to yourself, take a few deep breaths, and then come back into the conversation. So that's the best way to self-advocate for yourself.
My name is Leslie Daly. I have my master's in social work. I'm a clinical care manager at Craig Hospital. Self-advocacy is an important quality that one must develop after sustaining any sort of injury, and I mean, it's a good quality to have in life. I feel like advocating for oneself pretty much entails not taking no for an answer, learning how to communicate effectively on your own behalf to obtain services, resources, items, things that you might need, and researching and organizing your thoughts, your ideas, your resources in a way that you could easily and quickly retrieve those ideas and options. I think that when a person has sustained a spinal cord injury, self-advocacy becomes an important skill because there's a lot of things that have been taken from you as far as ease of like physical attainment. So you need to be able to convince people to help you. You need to be able to find what you need. You need to be able to communicate with your surroundings to meet those needs that you ordinarily might have been able to meet more easily prior to your injury. I think also there are limited resources for people with spinal cord injury in a way that they're limited because they may not be advertised or put forth as being for somebody with spinal cord injury, but they may exist and you just have to find the resources and sort of explain why that resource is valuable and needed to you. So at Craig Hospital, we are trialing a thumb drive program. For each patient that comes in is we fill out a request to determine what information we'd like put on these thumb drives. And this is a physical something that a person can take with them. And what we put on it are things like your local Center for Independent Living, which these are agencies in large areas. There's one in Colorado Springs, there's a few in Denver, and they're throughout the country in various states that know of local grants, advocacy organizations, and resources that we might not know of. So we put that on there. We put information about equipment, where to get your equipment serviced, where to get supplies like catheters and things like that that you might need. doctors in your area, physical and occupational and speech therapists, people who might have pool therapy. We also put federal resources like Social Security Administration, where your local one is. If you applied for Social Security disability while you're at Craig Hospital, we scan your application onto this so that you have it. Same with Medicaid. So we try and really look at the local area and tailor each thumb drive to each person. In addition to what Craig Hospital is doing as far as trying to provide tailored resources to each patient, there are some national agencies out there that would be worth patients who have SCI knowing about, such as the Christopher Reeves Foundation. That's a good one. They have lots and lots of links on there to other organizations. National Spinal Cord Injury Association is another good one that I would advise looking into. For patients who have already graduated from Craig, I would advise calling the nursing advice line to see about getting tailored resources for you. You can also call your clinical care manager to see if they might be able to help. But currently the program, we're really targeting our current inpatients. So some tips for people who have SCI when advocating for yourself as far as asking questions and communicating with people. I think the message of being assertive and not aggressive would be a good one. You know, you attract more flies with honey than vinegar. But you know, it's still okay to ask for help and for questions and to delve further. And if you don't feel that you're getting the response you need for us, you can ask for somebody else. In day-to-day interactions with agencies or caregivers, it's really important that patients do speak up. That's a real big focus, regardless of your level of physical ability at Craig Hospital. We want you all to feel, or all of our patients to feel, that they could pick somebody off the street who knows nothing about them and tell them exactly how to get them what they need as far as physical assistance. And I think that that trait and ability would carry over into resource finding and communicating with even, you know, state governments and things like that. Your ability to say what you need. I think that what we tell our patients a lot is that you are the expert on you. And so there's nobody better to express your needs than you. And I just think that if I could help empower patients who have SCI, families with loved ones who have SCI, to go after what you need and keep going. Don't take no for an answer.